Hello, hello, hello. Happy Sunday, friends. And welcome to Power Time. This is your hostess, Sharon Herbert, the Power RN, coming to you live from Power Nursing Innovations. Thank you always for joining us. And we certainly appreciate your feedback and your comments. So join us every Sunday at 5 p.m. Eastern Standard Time, where, of course, there is news from the world of healthcare. So thank you for joining us. And of course, comments and questions are absolutely appreciated. So thank you so much. And here we are, right at 5 o'clock Eastern Standard Time. So welcome to today's topic. And I want to remind you all that yes, it is 2025. And each and every day, I look at the news and I look at the research and I look at the questions and concerns that are brought up by people in the public. But you all are in the public as well. So let's stay abreast of what's going on in the world of healthcare. And today, and I think yesterday as well, I saw an article. I read a lot of what's going on in Medscape and in Becker's reviews. And if you haven't read those at all, I'm not going to say you must read them, but you'll find some really interesting snippets there. And one of them that we'll talk about today is about healthcare providers. And you may have heard about physicians and their status that's been reported really from the COVID pandemic. And things may not have changed a lot, but there's been some research on feedback that physicians and other healthcare providers have shared from the previous years, really related to the COVID pandemic. But some of those studies and conversations are still alive today. So let's talk about Medscape's survey. They've done a survey on physicians and suicide reports. And that's from the report has been completed and the data and the survey was done in 2023. And the response is really, truly a lot more still needs to be done. And some of the things won't be, a question for you. You'll understand and recognize some of these responses as well. So let's start with this. The Medscape survey that more than 1 in 6 physicians have reported that they had contemplated or attempted suicide. And I know some of you who have been on those front lines in the healthcare organizations won't question what, why, who, when. You'll know that that's true. And it's also been reported that 38% of the physicians know at least one other physician who has felt that way. The survey asked physicians what factors that they saw that was behind their concern. What's attached to their concern of suicide? And what plays a role in the way that they acknowledge job stress. Oh, does this sound like nursing? Yes, because we're all healthcare providers. And it is very hard to separate physicians from nurses during the frontline expressions of care and service during the COVID crisis. So we settle this by acknowledging that we are in same or similar places and spaces. So, can you understand why physicians may have responded with those types of responses to questions in the Medscape survey? How do healthcare professionals just get caught up in the same places and acknowledge the same stressors? Ooh, because we do some of the same things in some of the same places. We acknowledge and observe problems, and we go to where? What's the next step? What is the problem, and what could or shall we do? And some things you can't escape. So many of those physicians who've contemplated suicide but haven't acted, they've thought about it and they've thought, what can I do to get out of this space, even in a short term response? So the responses to the solutions for themselves, which may not always have been a positive response, because suicide is not a positive response. Those things were shared with the survey feedback. And the variations in responses really can be hard to explain because each person could have a different response. And some of the factors that were causing that type of response didn't help the situations. They weren't leading to a positive response. And there is one particular doctor that did the study on well-being. They talked about well-being and what are some of the factors that caused those physicians to feel stressed. Well, are they some of the same ones that lead to stress and anxiety for nurses? Yes, some of those same things. Are staffing shortages? Oh, do we really know that that could be true? Yes, some of the same, some of the same. And what about feeding into finding appropriate solutions to care for the patients? How many physicians do you believe could have been stressed out with trying to find solutions for positive care outcomes for their patients? Do you think that could be a stressor, especially during the COVID pandemic? Do you think that that could affect mental health in that scenario? How would you feel if your patients are dying and your patients are dying, or what you have proposed hasn't been an item that's been a positive impact for the patients? Because during the time of COVID and the millions of patients who didn't fare well or who died, there wasn't a solution. So physicians will come with the best that they can have because there was no solution. Vaccines didn't come until way down the road, several years into COVID. And if you were a health provider, as you are, and nothing is working for you, and nothing is working for your patients and your families, how could or would you feel? Could or would you be happy? Or could you be stressed? And you understand how that feels inside of you, but also what is the feedback to your stress when on, and each and every day there's a new healthcare challenge related to COVID or related to another poor outcome. You don't feel well, and society doesn't mark you as well, and politicians may not identify you as the best provider either. And what about nurses? What do we know? The responses from the physician providers are similar to the ones that nurses shared. And like nurses, we understand, but how does the provider escape the system? We understand what the physicians are going through. But can they just quit? Or can they just change their specialty? All of us can understand that particular challenge. It is just a part of the I want to get out, but I'm caught up in the system. And you think, well, what can I do? But after putting your hearts and souls into preparing for the future in service to those persons who need healthcare solutions, you have spent time, you have spent education, and you have spent finances in growing in your profession. And here comes COVID. Now, we haven't stopped COVID as that pandemic grew. And more doctors in many of the surveys, yes, said that they had never attempted suicide, but we know that that COVID pandemic certainly brought physician stress and suicide ideations to the forefront because we have suffered those same things ourselves. But even though 2023 brought us to a place of vaccine appreciation and use, that wasn't that long ago. It's 2025. And COVID is not over. People think COVID is over. Well, only the pandemic is over. The pandemic is the millions and millions and millions of people who have died. And even still, COVID has left many related problems. We still have folks who are suffering through long COVID. And those are symptoms and expressions that are physical, mental, spiritual. It is really hard to get over why you still are suffering from COVID. Long COVID. You can't go back to work. You feel rotten still. You are suffering from many symptoms that you can't get rid of. And people are telling you, well, there's no such thing as COVID. Now, that doesn't mean that all of the stressors have disappeared either. There is still staffing shortage. As we try several strategies to promote growth for service in healthcare by sharing good graces and trying very, very hard to promote healthcare practitioners to join us in the quest to help get rid of long COVID, to help encourage healthcare providers and the public to keep alert and abreast of what's going on with healthcare in their communities. In the meantime, here comes flu, here comes RSV. It's winter time. It's another challenge. And people are telling you, well, there's no such thing as COVID. Well, we're going to get rid of all of those vaccines. You don't need those anymore. And we don't need to deal with that. Now here comes bird flu. Wow. We just served and survived, and many haven't, monkeypox. There's one thing after another. And we just stopped talking about them. We just stopped talking about COVID. We just stopped talking about RSV. And we just stopped dealing with those things. The public doesn't have much concern as we should have because they don't hear about it. And they don't hear us dealing with those stressors that you talked about, whether it was staffing shortages, whether it was another virus. But that's not the answer. Putting things under the rug is not the answer. So we have got to do what needs to be done to care for the health and wellness of the community. We can't just stop talking about it. We just can't say, well, next time we'll, see what we can do. We can't put folks in places that aren't willing to help the public stay on top of what's going on in the community. Health disparities continue, and we can't just ignore them. Folks who are in areas where there are not a great number of healthcare providers, whether it's in a rural forum or those providers who used to care for them have left the general practitioner forum because of some of the other stressors, and now there are very few providers in the rural forums, and those demographics look very, very strangely low. And those providers have worked so hard and so long, they are tired. They are tired and they are overwhelmed those same old stressors. How will we have enough providers to care for those who are sick? We've got to do better, and we need to do better. 2025 is here. It is February, and March is coming soon. And then soon are coming the new grads. And I heard a news blast today that reminded us of the nurses that did not have enough resources during the COVID time, and those nurses made their way to create resources like gowns using plastic bags. Well, we do what we can, but that can't be the solution either. We must continue to do the research for the viruses that are popping up all over the world. It's not just in the US, it's not just in China, it's not just in Taiwan. We must do better. Measles is a rise in Texas. There are almost 100 cases of measles. Measles was something that was known when I was a young person in elementary school. But we got vaccines, and I didn't know a person from that time until my adult time that got measles. But know this, that one person who gets measles and is positive for measles, if they make their way into groups of other people, whether you're at a party or at Disney World, something bad is going to happen to some of the other persons in that space. So remember, we've got to pay attention. We have got to pay attention. As we've heard about the survey of physicians, you'll know that there are just as many in other healthcare provider roles, whether it's a physical therapist, whether it's a respiratory therapist, someone who is working in the pharmacy, maybe they're the pharmacy delivery tech, maybe they're the unit clerk. We're all at risk. So remember that we must do better. Closing down the research at NIH is really not the answer either. And we can look back at the solutions that were rolled out for non-vaccine or anti-vaccine persons, and there weren't a lot of good responses either on some of those proposed medications and or drinking bleach. So know this, we must do better. Physicians and other healthcare providers and caregivers in the homes and communities are at risk of losing their role as healthcare providers and or contracting some of these viruses themselves. Those won't be positive outcomes, and we've got to continue the research, how we will contain viruses, as well as the research on cancer. We can't just say, we're done, it's over, we can't do better. So be well, friends. Let's do these things together. Together we rise. Together we serve and save. This is Sharon Herbert coming to you live from PowerTime. And we are reflecting our thoughts and cares of service to others in our communities. The public needs you to help them bridge the gaps. Bridge the gaps in care, bridge the gaps in service, and provide information about the future in health care. They get the information that they can from nurses and health care workers and providers. Let's keep serving and saving. Come on, join us at powerinnursing.com, where we serve and save one life at a time. Thank you, friends. We'll see you soon, and be well, be well. This is Power Time.